Zollinger-Ellison syndrome is a condition in which one or more tumors grow in the pancreas or small intestine. The tumors, called gastrinomas. These gastrinomas produce large amounts of the hormone gastrin, which in turn gastrin causes the stomach to produce too much acid, which leads to peptic ulcers. Moving on to symptom of Zollinger-Ellison syndrome. Increased acid level causes stomach pain, diarrhea, burning, aching or discomfort in the upper belly, acid reflux or heartburn, frequent burping, nausea and vomiting, bleeding in the digestive tract, losing weight without any cause and unexplained loss of appetite. Cause of Zollinger-Ellison syndrome. It starts with a gastrinoma. This is a tiny neuroendocrine tumor, usually hiding in the Gastrinoma Triangle. It is an area on the anterior abdominal wall where the lower part of the stomach is in direct contact with the abdominal wall, bounded by the left costal margin, lower liver margin, and the transverse colon. This tumor is an overachiever. It pumps out a hormone called gastrin. Gastrin's only job is to tell the stomach's parietal cells to produce hydrochloric acid. Because the tumor doesn't have an off switch, the stomach is flooded with acid all day even when you aren't eating. This isn't just heartburn, it's a chemical flood that melts the protective lining of the gut. Now, here is the sophisticated part. About 75% of these cases are sporadic, they just happen, but 25% are linked to a genetic condition called MEN1, multiple endocrine neoplasia type 1. In these patients, the body has a hard-coded glitch that tells multiple glands, the pituitary, parathyroid, and pancreas, to grow tumors. If you have a family history of kidney stones or pituitary issues, along with ulcers, ZES is the first thing a wise doctor looks for. Coming to the diagnostic part, it is usually done in 3-step process. One step is blood test. Here it measures your fasting serum gastrin levels. In Zollinger-Ellison syndrome, gastrin levels are typically very high, often more than 1000 picograms per milliliter. Second step is check in acid baseline, that is gastric pH. High gastrin alone isn't enough. It must be confirmed that the stomach is actually producing acid. If the gastric pH is below 2.0, it confirms the high gastrin is causing extreme acid production or Zollinger-Ellison syndrome. Third step is the Secretin Stimulation test. If the blood test is borderline, doctors inject secretin, which is a hormone. In a healthy person, secretin lowers gastrin. In a Zollinger-Ellison syndrome patient, it causes gastrin to spike even higher. This is the gold standard for confirmation. Once Zollinger-Ellison is confirmed, doctors have to find the tiny gastrinoma tumors, usually in the Gastrinoma Triangle. So, for this gallium-68 scan is prescribed. It is the most advanced scan used today. It uses a radioactive tracer that sticks specifically to neuroendocrine tumors, making them glow on the screen. Secondly, endoscopic ultrasound is done where a camera with an ultrasound probe is lowered into the stomach to look at the pancreas and duodenum from the inside. Once the diagnosis is completed, doctors move on to the treatment part, which is a dual approach. Firstly, it focuses on managing the acid for lifelong control, wherein the goal is to stop the stomach from being eaten away by its own acid, for which high-dose proton pump inhibitor drugs like omeprazole or pantoprazole are the first line of defense. Zollinger-Ellison patients often need much higher doses than someone with regular heartburn, and sometimes somatostatin analogs like octreotide can help block the release of gastrin from the tumor. After medication, the second approach is the addressing the tumor, which is the real cure surgery needed. If the tumor is sporadic, present only in one spot and hasn't spread, a surgeon will remove it. This is the only way to cure the condition. If this deep dive into Zollinger-Ellison syndrome helped you understand the ultimate ulcer, don't forget to hit that like button. It really helps the algorithm reach others looking for answers. If you have questions about the Gastrinoma Triangle or want more medical breakdowns, drop a comment below. Be sure to subscribe and turn on notifications so you never miss our next clinical case study. Thank you so much for watching, and I'll see you in the next one.